Today we are going to discuss gallbladder and its surgical anatomy along with bile ducts anatomy. Gallbladder is a pear or globular shaped organ and situated in the right hypochondrium on the inferior surface of the liver. When we are drawing about nine abdominal region, this is where gallbladder is situated, right hypochondrium. On the inferior surface of the liver, as we all know that liver is situated in right hypochondrium, somewhat like this. My drawing is not so good, and gallbladder is situated like this. Below the diaphragm, our liver is situated, and gallbladder is situated in gallbladder fossa, which is anterior to the liver. It has, when we are talking about the parts of the gallbladder, we are dealing with its part, and it has its fundus part. This is its body, and this is its Hartmann's pouch. We are talking here about basically surgical anatomy. The Hartmann pouch has a clinical significance, has a important surgical importance. The narrow angulated distal portion of neck is called Hartmann pouch. Here it is. It's the commonest site where the stones tend to stay for a long time. It's also called infundibulum of gallbladder. And the gallbladder is drained into common bile duct. This is common hepatic duct. This is cystic duct. I made it large. This is not so large, not so big. Cystic duct drains into common hepatic duct, and the common hepatic duct along with cystic duct, they forms common bile duct. This is, we are not going to discuss it in a much important way. And the contraction of gallbladder produces a functional valve called valve of Hester. This is here the valve of Hester. As we know, it means functional valve, but there is no anatomical presence there, but it can act as a valve. The wall of cystic duct is surrounded by a sphincter structure called as valve of Hester, which prevents the migration of stone into the CBD. Valve of Hester, when contracts, it prevents migration of stone into the common bile duct, that is CBD. And we are talking about here Callet's triangle. This is Callet's triangle. What is Callet's triangle? Callet's triangle is also known as cholecystohepatic triangle. Means the triangle between bile duct, gallbladder and liver. Laterally, this is the lateral area. Laterally, cystic duct and gallbladder is there. This is cystic duct. This is gallbladder. Laterally, medially, common hepatic duct, and above inferior surface of right lobe of liver. As we know that the liver has two lobes. One is left lobe and other is right lobe. Right lobe is much bigger than the left lobe, which are divided by the falciform ligament. The contents of Gallett's triangle. Basically, right hepatic artery, I'm not going in detail, but you should know that the content of Gallett's triangle, right hepatic artery, its branches, and cystic artery. Cystic artery. Cystic artery is a branch of right hepatic artery, arises behind the common bile duct and it branches out on the surface of a gallbladder. Cystic artery is an end artery. And basically, what does we mean with end artery? End artery, there is no possibility of generation of collateral. So the chances of necrosis when the end artery got blocked, so the chances of necrosis is more. Lymphatics. Subserosal and submucosal lymph nodes denote the cystic lymph node of plant, and from there they drainage the nodes in the hilum of liver and celiac nodes. And we are talking about the anatomy of bile duct. Anatomy of a bile duct. As we all know that the bile duct is formed from common hepatic duct and cystic duct. But the bile duct opens into the second part of duodenum. Through sphincter of Oddi. Common bile duct CBD has 4 parts. Let me draw another picture for you. This is very much rough diagram. This is, let us consider gallbladder, cystic duct, common hepatic duct coming from liver. This is cystic duct. This is common bile duct. Common bile duct, this opens into the second part of duodenum. This is second part of duodenum. And here pancreas is situated. So this is common hepatic duct, and this is, we discussed, open into the second part of duodenum through sphincter of Oddi. This is what? Sphincter of Oddi. This is what? This is pancreatic duct. Common bile duct along with pancreatic duct forms hepatopancreatic duct. So they opens through sphincter of Oddi. Now we are discussing basically about the anatomy of common bile duct. It has 4 parts: supraduodenal, above the duodenum, and it is behind the duodenum. So it is second part, it's retroduodenal. Another one is intraduodenal, and which is last in the duodenum, that is intraduodenal. This is all the surgical anatomy of the gallbladder, bile duct, and